CBS News medical contributor Dr. David Agus joins us now. David, good morning. As you just heard Ben say, the president's doctor said he may not be entirely out of the woods. Dr. Fauci said there could be a reversal in the next few days. How critical are these next few days for the president?
Well, he's still on dexamethasone. So dexamethasone or Decadron, this steroid, we use until lungs improve. So obviously his lungs aren't improved because he's still on that medicine. And I have seen cases where you get continually improvement from this point, but I've also seen cases where there's a lull and then things get worse. And that's what we're worried about. You know, he feels well. You take off the Decadron, the steroids, he's not going to feel well and there will be a crash. And that energy we're seeing now will go away.
What do you think is the significance of the doctor not wanting to show the president's lung scans?
Well, saying, well, it's HIPAA, which is the Patient Privacy Act, really isn't appropriate because the president, the patient, can say, it's okay for you to tell people about my lungs. So what he's saying is the president doesn't want people to know about that lung scan. It's critical that we know whether there's 10% involved, 50% involved, 80% involved in the lungs. Whatever that number is tells us how critical his disease is and likely what his course will be.
David, we also still don't have an answer on when the president last tested negative. Why is that information so important?
Well, it's important because it will say who he was exposed to. I mean, who was exposed to him. So it's about other people. It's about caring for everybody who, when you were positive or could have been positive and you had intimate reactions, interactions with somebody, they need to be quarantined and tested. That's how we contact trace, and that's how we stop the spread of the virus. That is critical so other people don't get infected with this virus.
So, David, why do you let someone out of the hospital who all the experts say is not out of the woods yet with so many uncertainties? I realize the White House has top-of-the-notch facilities, but it's still not a medical center.
So on Friday, when this all began, he didn't really have a team. A team was built, and so now he was transferred. So I don't think it is a discharge as much as a transfer to the White House, where those same doctors will manage his care. And if something goes wrong, if it gets worse, he has trouble breathing, they could take him down to the ICU unit. And I've seen it. It is state of the art. They can put him on a ventilator and transport him within minutes, literally back to Walter Reed. So I don't think that part's unsafe. I think it's obviously he's not out of the woods, and I think that's critical. But we're going to continue to follow him in the White House.
Yeah, the president raised a lot of eyebrows, and I think hurt a lot of people's feelings, especially when you think that 210,000 people have died. When he says, listen, I feel really good, don't let it dominate your life, don't let it take you. I kept thinking about how the families that are still grieving would hear those words. What did you think when you heard them?
Well, I thought about 210,000 people would love to have a team of 10 doctors dedicated to them, would love to have access to medicines that aren't yet FDA approved. And me as a scientist, as a doctor, I think there's real hope with these medicines. They would have loved access to those medicines when they were sick. And so it's not necessarily genuine to say my story is your story when the president talks about people with COVID-19.
Yeah, he plans to participate in the next debate. I think it's like 9 days away. Is that realistic, or is it too hard to say right now?
Well, let's see what happens when the dexamethasone is stopped. I've seen, patients who have a dramatic drop in their energy the day after. I had a patient 2 months ago. I put him on steroids. That next day, he called a contractor to build an underground bowling alley at his house. Several days later, we took him off steroids. He goes, wow. I hate bowling and I have no money. Why would I do such a thing? That's the steroids. And so we'll see what happens when those steroids stop and when the doctors think he is not infectious anymore.
All right.
That's quite a story.
That's kind of a funny story. Yeah. I hate bowling. Okay. Thank you, David Agus. Thank you very much.
I hope they didn't start construction.
I think there's already a bowling alley in the White House. Richard Nixon built one.
Right.
That's right.